And now we shift our focus to the emerging hiccups in the transition to the Social Health Authority, where tonight it is emerging that patient perception of SHA services remains predominantly negative. According to the latest report by the Rural and Urban Private Hospitals Association of Kenya, at least 67% of Kenyans have expressed dissatisfaction with the services, with only 47% of facilities providing free outpatient services. RUPHA's 6th SHA transitional scorecard has also highlighted the functional shortcomings of the portal, which has caused delays in registration and in service delivery. Safin Aching Oma has those details.
More than 2 months since the transition to the Social Health Authority, thousands of patients still face challenges accessing healthcare services in hospitals across the country. A survey done by the Rural and Urban Private Hospitals Association of Kenya, RUPHA, demonstrated an overwhelming negative perception about the Social Health Authority, with 67% of Kenyans expressing dissatisfaction with the services. According to the survey, which was done within the second week of December, in about 500 hospitals in the country, a majority of beneficiaries and service providers cited inadequacies in the functionality of the SHA portal.
We found out that sometimes patients wait for 3 hours before their one-time PIN comes in. And in cases of surgeries, it was even worse because they were going for up to 24 to 72 hours to get pre-authorization. So the delay in care was another reason why the sentiment around patient care was really poor.
RUPHA is also raising serious concern about the sharp drop in training adequacy, which indicates growing dissatisfaction among providers.
It's like constructing a house while you're living in it. So it rains in on you. You have no power, you have no plumbing. So the SHA portal itself is changing so fast, but training is not keeping up to the changes in the portal.
Another challenge is the burden of cost, with about 48% of beneficiaries included in the survey reporting incurring frequent out-of-pocket expenditure.
The other thing that is driving out-of-pocket expenditure we saw in 27% of facilities, basically they don't have supplies. They don't have consumables, they don't have drugs. So just to keep themselves going, you find that patients are having to pay cash.
The grim results coming with the Social Health Authority confirming that up to 3.7 billion shillings has been disbursed to health facilities.
The public statements are not reflected in the bank accounts. So what has been happening since October is a policy posture by SHA to pay only SHA bills. What I mean, they are only paying claims generated from 1st of October. Now you realize most providers have much more exposure from pending NHIF bills.
The survey also depicts a sluggish progress in addressing the emerging challenges since the transition to SHA in October 2024.
If we had taken 2 years from 2023, say October, and given a hard stop as October 2025, we would have had sufficient time to get ready, to prepare, and to do this better. But here we are.
The results coming amidst a spirited campaign by the government for Kenyans to embrace the Social Health Authority initiative, emphasizing its potential to revolutionize healthcare delivery in Kenya.
Why am I paying 39,000 shillings? The people in Kenya who used to pay 500 NHIF, 54% of them now are paying 300 shillings. Secondly, the 39,000 I am paying myself, members of parliament, people who want a lot of money, they are paying more so that Kenyans who have no job can access health care. They can be treated free.
Safin Aching Oma, Citizen TV.